Hello everyone. In this video on obstetrics, today we will be talking about abortion, that is spontaneous abortion, about miscarriage in detail. This video is primarily for MBBS final year who are preparing for their university exam, uh, and we will be talking about miscarriage today. And we will be mainly focusing on uh, every important detail for the MBBS exam, about the classification of abortion and their clinical feature, signs, symptoms, management, investigation, and about all the different types of abortion. So let's begin without delay. So, firstly, what is abortion? The abortion is a expulsion or extraction of embryo or fetus from its mother. That is weighing 500 gram or less, or when it is not capable of independent survival, according to 22 weeks by WHO. And it is worth noting that the definition of abortion is varies from source to source and country to country. So let's revise it again. So abortion is the expulsion or extraction from its mother of an embryo or fetus weighing 500 gram or less when it is not capable of independent survival. This 500 gram of fetal development is attained approximately at 22 weeks, around 154 days of gestation, and the expelled embryo or fetus is known as abortus. And the word miscarriage is the recommended terminology for spontaneous abortion. The incidence of miscarriage is around 10 to 20% of all clinical pregnancies. About 75% miscarriages occur before the 16th week, and of this 80% occur before the 12th week of pregnancy. So now we will talk about classification of abortion. The abortion is classified as the spontaneous abortion, that is known as miscarriage, and the induced abortion known as deliberate uh, abortion. And the spontaneous has the two types, that is isolated sporadic abortion and the recurrent abortion. And these are further classified into various subtypes like threatened abortion, inevitable abortion, complete abortion, incomplete abortion, missed abortion, and septic abortion. And in this video we will be mainly talking about these about this spontaneous pregnant miscarriage. And about the induced, it has one legal, is induced legally done abortion, that is medically terminated pregnancy, and that another one is known as illegal unsafe abortion. And in illegal, the septic abortion is common. Okay, now we will be talking about etiology of abortion. The etiology of miscarriage is often complex and obscure. The following factors, embryonic or parental, are the important. There are various different factors, and we will talking in one by one. And first one is chromosomal or genetic factor. Majority of 50% of the early miscarriages are due to chromosomal abnormality in the conceptus. The remaining abortion are euploid. And the autosomal trisomy is the most common cytogenetic abnormality. And and the polyploidy has also been observed in around 22% abortus. There can be monosomy X and triploidy also. So and and the structural chromosomal rearrangement are also observed in 2 to 4% of abortus. These include translocation, deletion, inversion, ring formation, and other chromosomal abnormalities like mosaic double trisomy are also found in 4% abortus. 95% of all chromosomal abnormalities are caused by error in the maternal gametogenesis, and about 5% are due to paternal error. So, and triploidy is observed with hydropic molar placental changes. So, these all chromosomal abnormalities are mainly due to error in maternal gametogenesis in the ova. And secondly, we have endocrine and metabolic factors, that constitute 10 to 15%. The luteal phase defect result in early miscarriage, as implantation and placentation are not supported adequately. The deficient progesterone, the deficient progesterone from the corpus luteum or poor endometrial response to progesterone is the cause for this. And thyroid abnormalities like overt hypothyroidism or hyperthyroidism is associated with increased fetal loss. The thyroid autoantibodies are often increased. The diabetes mellitus, which are poorly controlled, causes an increased miscarriage. And the anatomical abnormalities is constitute 3 to 8%. The cervicouterine factors are related mostly to the second trimester abortion, and these are mostly related to second trimester abortion. And here the cervical incompetence is one of the most common cause of the uh, um, abortion in second trimester, and the congenital malformation of uterus in the form of bicoordinate or septate uterus may be responsible for mid-trimester recurrent miscarriages. The causes of fetal loss are causes of fetal loss in this congenital malformation is due to reduced uterine volume, intrauterine volume, reduced expansile property of the uterus, and the reduced placental vascularity when implanted on septum, and increased uterine irritability and contractility. Due to this, there occurs abortion. And the uterine fibroid. Uterine fibroid, especially of soft mucus variety, might be responsible not only for infertility but also for abortion. This is due to distortion or partial obliteration uh, of uterine cavity. Other causes are decreased vascularity at the implantation site, rare degeneration of fibroid, and the increased uterine irritability. And third or fourth one, intrauterine adhesion cynically interfere with the implantation, placentation, and fetal growth. Depending upon the severity of adhesion, example total Asherman syndrome, corporal or cervicoischemic, patient suffers from amenorrhea, hypomenorrhea, infertility, or recurrent abortion. And the infection are accepted causes of late as well as early abortion. The transplacental fetal infections occur with mostly microorganism, and fetal losses could be caused by any infection that could be viral. In viral, we have the rubella, cytomegalovirus, variola, vaccinia, or HIV infection. This can cause abortion. In the parasite, we have the toxoplasma and malaria. They can cause abortion. In bacteria, we have urea plasma, chlamydia, and brucella. These can cause abortion. And spirochete, like syphilis, hardly cause any abortion before 20 weeks because of effective thickness of placental barrier. And about the immunological causes, immunological disorder constitute 5 to 10% of the cases, and the antiphospholipid antibody syndrome, APAS or APLA syndrome, is due to the presence of antiphospholipid antibodies. These antiphospholipid antibodies are lupus anticoagulant, anticardiolipin antibodies, and beta glycoprotein 1 antibodies. So what are APAs? So we will write here. Firstly, we have the anticardiolipin antibodies, beta 1 glycoprotein 1, and also the lupus anticoagulant. Due to these are three antiphospholipid antibodies. And the mechanism of pregnancy loss in this antiphospholipid antibody syndrome is that in these, the inhibition of trophoblast function and differentiation occurs, and also activation of complement pathway, and due to release of various local inflammatory mediators, cytokines, interleukins, and the thrombosis of uteroplacental vascular bed ultimately leads to fetal hypoxia, and that cause abortion in APLA syndrome. So in immune function, and about various other immunological factors, cytokine can cause various abnormality in cytokine response can cause abortion. We have two types of cytokine response, that may be either T helper 1 TS1 type or T helper 2 type. The T helper 1 response is the production of pro-inflammatory cytokine, and the T helper 2 response is the production of anti-inflammatory cytokines. So T helper 1 response is the production of pro-inflammatory. Pro-inflammatory cytokine are interleukin 2, interferon, and tumor necrosis factor. And T helper 2 response is production of anti-inflammatory cytokine like interleukin 4, 16. The successful pregnancy is the result of predominantly T helper 2 cytokine response. This is anti-inflammatory cytokine. If this is prominent, then there will be successful pregnancy if this T helper 2 response is more. But if there is more T helper 1 response, then there will be recurrent miscarriages. So that is the concept behind it. And the next one, we have the autoimmune factor, and various autoimmune disorder like SLE can cause abortion. And we have in the sixth, we have the maternal medical illness. We have the cyanotic heart disease, hemoglobinopathies, and these are associated with early miscarriages. So that was. And then in the seventh cause, we have the premature rupture of membrane that inevitably leads to abortion. Premature rupture of membrane. We have the paternal factors like sperm chromosomal anomalies like translocation can cause miscarriage. Some women who miscarry recurrently have successful pregnancy following miscarriage with a different man. And also the thrombophilia. Inherited thrombophilia causes both early and late miscarriages due to intravascular coagulation and thrombosis. Protein C resistance, factor 5 Leiden mutation. This is factor C Leiden mutation is the most common cause. It is the most common cause for abortion, and other conditions are protein C deficiency, and hyperhomocystinemia. Antithrombin 3 or prothrombin gene mutation can cause thrombophilia, and these can result in abortion. And finally, we have various environment factor. The various environmental factors are related to the abortion. So for example, cigarette smoking increases the risk due to formation of carboxyhemoglobin, and the decreased oxygen transfer, and that leads to decreased oxygen transfer to the fetus. And alcohol can also should be avoided during pregnancy. And we have the X-ray irradiation is known to cause abortion, but the X-ray exposure less than 10 radiate are as less risk. And we have the contraceptive agent like IUD, in situ IUD increases the risk for the abortion, but oral pill do not have any effect. And the drugs, chemical and noxious agent, anti-neoplastic drugs, various anti-neoplastic drugs, the anesthetic gases, arsenic, aniline, lead, formaldehyde, they increase the risk for abortion. And we have various miscellaneous causes like exposure to electromagnetic radiation from video display terminal. It is said that this does not cause abortion. This has done what. And also, so that's why women can use hair dye. Pregnant women can watch television. They can fly in aeroplane in the pregnancy too. So there in the miscellaneous factor includes various other factors. And unexplained, and we have the 40 to 60% of pregnancy are unexplained. In spite of numerous factors mentioned, it is sometimes very difficult in majority of the cases to pinpoint the exact cause of miscarriage. Too often, more than one factor is present. However, risk of abortion increases with the increased maternal age. About 22% of all pregnancies detected by serum beta HCG are lost before the clinical diagnosis. So let's see the summary of the common causes of miscarriage trimester wise. In the first trimester, the main causes of miscarriage are genetic factor in 50% of the cases, the endocrine disorder like LPD, thyroid abnormalities, and the diabetes, immunological disorder, autoimmune and autoimmune, the infection, and the unexplained causes. In the second trimester, we have the anatomical abnormalities like cervical incompetence, congenital or acquired, Mullerian fusion defect like bicornuate uterus or septate uterus, uterine synecdoche, uterine fibroid, maternal medical illness, and finally the unexplained causes. Now we will talk about the mechanism of miscarriage. In early weeks, the death of the ovum occurs first, followed by the expulsion. And before 8 weeks, the ovum surrounded by the villi with the decidual coverage is expelled out intact. Sometimes the external os fails to dilate so that the entire mass is accommodated in the dilated cervical canal, and it is called cervical miscarriage. So this, let's see the picture. This is known as cervical miscarriages. The external os fails to dilate so that the entire mass is accommodated in the dilated cervical canal, and it is called cervical miscarriage. And between 8 to 14 weeks, the expulsion of fetus commonly occurs leaving behind the placenta and the membrane. A part of it may be partially separated with the brisk hemorrhage or remains totally attached to the uterine wall. And beyond 14 weeks, the process of expulsion is similar to that of mini labor. The fetus, it is somewhat like mini labor. Similar, just like in liver, the fetus is expelled first, followed by the expulsion of placenta after a varying interval. So thank you, and now we will be talking about threatened miscarriage in the next video, and that was that. Thank you.